Why has dermal filler had such bad press? Give me 2 minutes and I'll show you it's not the filler, it's poor training, patchy regulation and budget products. Dermal filler is one of the most effective tools in aesthetic medicine for restoring volume, adding structure and camouflaging areas of heaviness. It's a gel made from hyaluronic acid, a molecule your body already makes, stabilized so it stays where it's placed, then gradually breaks down over 1 to 2 years. Used correctly, it's precise, adjustable during the procedure, and reversible with hyaluronidase if the look isn't right or if a complication occurs. That undo button is a major safety advantage. So why the bad press? Firstly, regulation has seriously lagged behind demand. In England, non-surgical aesthetic treatments have minimal to no regulation. You can have 0 medical qualifications and legally carry out dermal filler treatments. One day you're a postman, and after a 1-day course, you're injecting a gel implant into someone's face. Yes, it's that bad. And this is the main reason patients encounter significantly different standards of care and wildly different cosmetic outcomes. The second reason is inexperience. Most training academies provide a 1 to 2 day foundation course as an entry point into injectables. These might be a good starting point, but they are not a substitute for the thousands of hours required to learn about facial anatomy, patient psychology, and complication management. When the practitioner lacks a depth of understanding, you see overfilling, poor product placement, migration, puffiness, and a higher risk of complications. It's not the gel's fault, it's the person holding the syringe. The third reason is product quality. Weirdly, dermal fillers are not deemed as medicines, they are classed as medical devices. What this actually means is that the regulation around them is significantly more relaxed when compared to licensed medications. It usually takes around 10 to 15 years of testing, research, and thorough clinical trials before a medicine is available to the public. None of that is required with dermal fillers. Now, there are some excellent, tried and tested brands of dermal fillers available, but there are also some very cheap budget and quite frankly rubbish dermal fillers out there. Using the right product is important for the best cosmetic outcomes and complication avoidance. Layer all of these reasons onto social media and what do you have? A cycle of overfilled looks, then mass dissolving trends, sensational stories that conflate poor technique with the nature of dermal fillers itself. Meanwhile, peer-reviewed evidence still shows dermal fillers, when injected by experienced clinicians, have very high levels of patient satisfaction and a low complication rate. The solution isn't to get rid of dermal fillers, it's to raise standards. I'm not sure how the aesthetic industry will look in the future, but I hope there will be clear and thorough training pathways, regulation around who can carry out these procedures, and strict regulation around what dermal fillers can and cannot be used. The bottom line is that hyaluronic acid-based dermal fillers are not inherently bad. It might seem that way because of inconsistent training, lack of regulation, and variable quality of products. In skilled hands, using premium products and an ethical approach, dermal fillers remain one of the safest, most precise, and predictable ways of restoring facial volume and adding structure.